la sala.
Good morning, everyone who's joining us.
Muy buenos días a todos los que
Good
ya
morning,
están
everyone.
en la sala.
Good morning, everyone
Vamos
who
a dar
has
unos
already joined
minuticos
us. We will wait
que el
for a
resto de
few
las
more
personas se
minutes
puedan unir.
for the other people to join.
Voy compartiendo mi
I
pantalla.
will share my screen with all of you.
Bueno, de nuevo muy buenos días y buenas tardes
Good
a las
morning or
personas
good
que ya están
afternoon
en la
to
sala.
all of you
Hoy estamos
who have
en esta
joined us
última sesión
already. This is
del
our
curso de
last
contexto de cambio
session
climático para la salud en
for
América
our
Latina.
climate change
Em,
response course.
y pues estamos muy emocionados
And we
de
are so
haber
excited
estado con ustedes durante estas
to
5
have
semanas.
shared
Hoy, por
the
supuesto, vamos
past
a
5 weeks
tener
with you.
una última sesión
We will have our last
que
session
va a ser
today,
bastante interesante para hacer el cierre de este
and we
curso.
think that it will be a
Como
very
siempre, quiero
interesting
recordar a las
closing
personas
session.
que
Let
hicieron el
me
proceso de
remind
organización de este curso.
everyone
Fue la Universidad de Columbia,
that, well, those
el
in charge of
Centro del
organizing
Clima,
the
de
course,
Educación,
Columbia
Clima y Salud,
University, Global
la
Consortium on
Interamericana de
Climate and
Investigación de
Health
Cambio Global y la Organización
Education,
Panamericana de la Salud.
PAHO, and the WHO.
Como siempre hemos mencionado, el curso se tomó en español o en inglés. En esta nueva
The course
sesión, pues
can
igual
be
también tienen la posibilidad de usar el
listened to in
español como
English or
traducción,
Spanish. We do have
dependiendo del idioma que
simultaneous
puedan
interpretation available in
utilizar.
either English or Spanish, depending on what
Como
your
mencioné,
preference
hoy
is.
estamos en nuestra
And
última
as I said
sesión del
earlier,
curso.
today is our last
Vamos a
session.
trabajar el tema de recomendaciones regionales
We
sobre el
will
manejo del cambio
work
climático.
on regional
Vamos a tener
climate
además expertos
change
conferencistas del
policy
Departamento de Health de
recommendations,
la
and we
Organización
will hear
Panamericana de la
for
Salud y
Dr.
la doctora
Daniel
Stella
Buzz from
Hardinger de la
PAHO
Universidad
and
Peruana
Dr.
Cayetano Heredia.
Stella Hardinger
Entonces,
from
en este proceso vamos a
Peruvian
recordar un poquito
University,
la
Cayetano
dinámica que vamos
Arriba.
a tener en la sesión de hoy.
And
Hoy vamos a
for
tener una
today, we
sesión
will have
que
a
tiene dos partes. Una que
two-part
tiene que ver
session.
con
We will
las
first
conferencias de nuestros dos
hear from our two
conferencistas. Luego vamos a tener un
speakers,
tiempo para hacer el cierre y dar
and then we
algunas
will
indicaciones de cómo
have some
continuar el
time
trabajo
for
con esta comunidad de
closing
participantes.
remarks and what
Como
the
siempre,
next
pues el
steps
idioma
are.
principal es el español.
The main
La
language
sesión de
for
hoy,
this
como todas
session
las
is
sesiones, quedará
Spanish.
grabada y será
The session
disponible
will
a
be
las 24
recorded,
horas
as were the
de esta
others, and
sesión.
it
Y
will
como
be
todo,
uploaded
los
12
materiales
hours
y las
after the
referencias que hemos
session is
utilizado
completed,
estarán
and
dispuestas
all of our
en la
materials
página
are available
del consorcio.
online
El
on the
consorcio, pues,
Global
para que ustedes
Consortium
pues,
site.
la han venido navegando
This is
durante
the
estas
site that you
5 semanas.
can see on screen, and I'm
Hoy
sure
nuestro
you are
primer
familiar with it by now.
conferencista es el
Our
doctor
first
Daniel Bus,
speaker is
el
Dr.
doctor es
Daniel
biólogo,
Buzz. He's a
doctorado en maestría en
biologist.
ecología y
He has a
es hijo de
master's in
PhD en
ecology and
ciencias.
he has a PhD in
Él ha
public
sido
health.
investigador de Fiocruz en
He's a
Brasil
CEO Cruz in Brazil
por ya
researcher,
bastantes años
well, for many
y desde el
years.
2016
And since 2016,
viene trabajando como asesor en clima
he
y salud
has
en la
been
Organización
working as
Panamericana
a
de la Salud.
climate and health consultant at PAHO.
Adicionalmente a trabajar en la Organización Panamericana de la
He
Salud y en haber
has
trabajado
also
en
worked,
Fiocruz,
in addition to working at
también
PAHO and
tiene el
Fiocruz.
doctor Bus una
Dr.
dedicación
Buzz
a lo que tiene que ver con la parte de biodiversidad,
also
la
works on
parte de bosques y
biodiversity
por supuesto
issues,
con todo lo que
forests,
tiene
and of
más que
course,
encontrarse con salud pública.
their
Vamos
connection
a
to
entrar
public
también
health.
a nuestra otra conferencista, que es la doctora
Our
Stella
second
Hardinger.
speaker for today, Dr.
Ella
Stella
es
Hardinger.
profesora de la Universidad
She's a
Peruana Cayetano
professor
Heredia
at the
y
Peruano Cayetano Heredia University.
hizo
And in
una
addition,
maestría y un
she
doctorado en
has a
epidemiología.
master's and PhD
En
in
este momento
epidemiology.
ella dirige el Centro
She is
Latinoamericano
currently
de Excelencia en
heading
Cambio Climático y
the
Salud
Latin American
y
Excellency Center
adicionalmente
on
es la
Climate
líder de
Change
la
and Health.
Suramérica
And she also
de la
leads
iniciativa
the Landsat Global Initiative for Latin America. And she has worked with different focal points across the region. So without further ado, I will hand the floor over to Dr. Bus so he can begin with his talk for today's session. Thank you, Gilma. It really is an honor for me to share this session with you today. Today is our final session, and this has been such a nice journey for all of us. Can you see my screen? Yes, we can. Great. It has, from the organizer standpoint, it's been such a great journey. We've received great messages, a lot of support on WhatsApp, on the different networks, and it's really great to be here with you today. And it is always a challenge to be one of the final speakers. We have heard from such great speakers and we have learned so much. So really I have the chance to honor all of those who came before me and sort of tie this presentation to what was discussed before and what we discussed in these past 10 sessions. So I am very happy to be here with all of you today. And I am happy to say that this is the beginning. This is not the end, but the beginning of a process that we have started. We have taken some steps already with many of you, and we are happy to be here and share this work with all of you. Our learning objectives for today is to explore tools and programs for climate change, follow up on the impacts on health in Latin America and the Caribbean. And let me show you a picture that I think this is a picture from the events in California, US last year. And it really shows some of the things that we are facing today. We have the COVID-19 pandemic, and at the same time, we are facing other global crises that have a similar environmental origin, how our societies consume, how we live, how we move, the services that we use, the transportation that we use, the products. So the origin is similar. And that picture, I think, illustrates this very well. We are looking at a forest fire, and there are several factors, climate change factors, increase in temperatures, longer droughts in California as a result of urbanization and lifestyle. And it is also affecting or jeopardizing or putting a senior center at risk. So it says to wear a mask, that you should wash your hands, to keep your social distance. And all of these challenges are challenges that we share and are very serious and very complex. We are, in the past couple of years, we have spoken about a triple global crisis. Climate change. Right now, I am actually at the Caribbean for the Green Climate Fund, and I see the complete destruction resulting from a Category 5 hurricane, Irma, Maria, and others. And it is amazing to see the power of these extreme climate events. And we learned from that, from Gilma's session during the first day of the course. And then a second global crisis is associated to pollution, air pollution, water pollution, environmental pollution, jeopardizing the way in which we live. And of course, those who are most vulnerable are always the more severely affected. And then the third crisis is the loss of biodiversity, affecting how we live, how we connect to the environment. And Bianca Macho, I think, really touched us all in her presentation. I was very moved by her presentation. And these are all the lessons that we have to learn.
So in these lectures, we've seen how climate change can have a direct impact. I have talked about extreme events, heat waves, wildfires, disasters, atmospheric contamination, air pollution, water pollution, also change in the distribution of vectors, hosts, and pathogens, also food security, water insecurity, conflicts. And there are some filters as well here. We can apply two filters. First of all, the social and behavioral context, also social vulnerabilities, economic vulnerabilities, and the way in which this has to do with the environment, genetics, etc. And also the health system and how it works, if it is ready or not to provide solutions. And these are health systems, not just as provided by the health sector, but also actions that can be promoted, that can actually promote or improve health or harm health, people's health. And these are all factors that can modulate the impact on health. Therefore, health actions can take place at the top between climate change and the mitigation actions and also greenhouse gas emissions, or they can be placed at the bottom and have to do with adaptation. So once we cannot prevent things from happening, we can then take actions in order to be prepared, in order to respond effectively and to anticipate these events and to, in a way, decrease the impact on health. I think it is very important to understand the context. Many of the speakers addressed this when they talked about vulnerability. We need to understand that combating climate change and improving society's resilience has to do not just with internal actions within climate change and health agenda. It has to do with a development agenda. It entails protecting the most vulnerable. And just regarding the Americas, Latin America and the Caribbean, North America, sometimes there is a situation that takes us back to some centuries ago. For instance, there is open air defecation still in some areas in Latin America. These areas need our support to fight climate change because they sustain the direct impact of the environment where they live, the housing where they live in. The climate change can actually exacerbate these factors. And these are the elements we need to focus on in order to decrease vulnerability, improve resilience to climate change, and to help people be healthy. Health is a prerequisite for healthy societies in order to make progress and develop in a sustainable manner. It is also a result of the Sustainable Development Goals and of the actions we take. So having this health perspective allows us to invest in development, and we also need to create resilience to climate change. These are all factors we need to consider. We have over 1 million premature deaths a year because of environmental risks that can be avoided, prevented. And there is a difference between countries of different types of income. Lower income countries have more deaths caused by these environmental hazards. But you can see that there is a difference. Vivian, Mario talked about these processes and why it's important to understand these elements. And we need to try and recover and strengthen communities, especially those that are excluded, those that are not part of the processes. And this is essential to increase resilience to climate change and to other environment-related hazards or hazards that have to do with social or economic vulnerabilities or an account of exclusion. This has to do with equity, most of all. And this is what we need to keep in mind and in our hearts as well when we work with climate change. I would like to mention, I'm saying this to, highlight this connection between these elements. Air pollution, as we have seen in some amazing lectures we had in this course. It was something like 320,000 premature deaths in Latin America and the Caribbean due to heart disease or respiratory diseases and cancer. Over 74 million people use polluting fuels at home, wood, coal, kerosene for cooking and heating. There is still a high vulnerability rate in the Americas. And climate change affects these people the most. Of course, we all feel the impacts of climate change, but these people, the excluded people, are the ones that are most affected, and this is something that we need to consider as a priority. Well, now we have a Zoom poll. There we go, Haley. Okay. It's a simple question. How can we, I'm not sure the answer is simple, but how can we achieve healthy and green recovery in this COVID-19 situation? When we think about climate change, it's a triple planetary crisis: COVID-19, climate change, the pandemic. How can we think outside the box? How can we learn from the pandemic that has shown us that these weaknesses in the systems, the way in which people work, how we consume, how we live, and this has created a triple planetary crisis, COVID, etc. We have early warning systems, we have health systems, etc., that are ready or not. So what can we do to learn from this pandemic and, recover from it and progress as a society? Here we have the 6 options: protect and preserve nature, invest in water, sanitation and clean energy in health premises, ensure a quick energy transition, promote healthy and sustainable food systems, build healthy and healthy cities where people can live in, and stop subsidizing atmospheric contamination. Okay, there we have the results. So this is really interesting. We have several different responses. Protecting and preserving nature, investing in water, sanitation and clean energy, also building healthy cities where people can live in. there are actually no right or wrong answers in this sense, but we wanted to hear from you. These are a few of the elements within the WHO manifesto for green and healthy recovery from COVID-19. And here we have some sort of recipes. These are not the only actions, but are some elements that we can consider what we learned at the WHO, so that we see what we can offer countries in the Americas, in the case of PAHO. First of all, protecting and preserving nature as a source of human health. It is because of that relationship that we have this kind of problem. So nature-based solutions also apply to climate change. And we should also rethink the way in which we relate to science, to the nature, the environment, the Pachamama in Spanish, and well, so many of the things we have seen throughout the course. Second, investing in essential services, water, sanitation, reducing the vulnerability of the health system so that it works properly before, during, and after extreme climate events, for instance, when hospitals are really necessary. 3, ensuring a quick and healthy energy transition. We should change energy grids in order to reduce our carbon footprint, and also to, reduce the causes of climate change. Promoting healthy and sustainable food systems. This is essential for human health. These food systems should be local and organic as far as possible, and they should be structured carefully. 5, building healthy and livable cities, and of course the countryside as well. The thing is that 80% of our population lives in cities nowadays, but there are different ways of living. We need ways to live in a healthy way. And finally, we should stop subsidizing pollution. At PAHO and the WHO, we also have a regulatory role. So we're working with countries to see how we can, for instance, increase taxes on economic activities that actually create pollution and create health problems. And then the country itself needs to, foot the bill at hospitals. These are a few of the elements, and of course, feel free to read the manifesto itself. Now, as I speak from PAHO, and we are the regional office of the WHO for the Americas, we always keep in mind the Sustainable Development Goals as one of our main challenges. At PAHO, we have the Sustainable Health Agenda for the Americas. Here we have a health perspective by considering the Sustainable Development Goals, as countries have decided to work on them. They have decided to work on health throughout the SDGs, and also PAHO's strategic plan. Very recently, last year, this document was launched, this agenda, as launched by PAHO. It has 4 thematic areas: climate change and health, chemical safety, water, sanitation and hygiene, air quality, and health. There are other topics as well, and there are connections with other departments and sectors we work with. And we also have strategic actions: improving the performance of environmental public health programs by institutions, encouraging the health system to be environmentally friendly and resilient, and promoting environmentally healthy and resilient cities and communities. These are a few of the actions. Specifically within the climate change and health agenda, we have a specific health and climate agenda. We have heard about these elements in the lectures that came before me. Number 1, we would have governance and institutional structures. If we do not have well-informed ministries of health, of course, we have many colleagues from Ministry of Health today, and they are representatives in the area of climate change and health. So I'm so happy to be able to talk to you as we have so far. And I think it's great that some countries have, appointed focal points within the Ministry of Health on the topic of climate and health. And within the ministry, there is an advisory committee in order to include the opinions of several sectors and the civil society and also from the private sector and all the stakeholders, so that the Ministry of Health can actually have a position and then share it with interministerial climate change committees. This is why it's so important to have a clearly defined governance and institutional structure, because this is what allows us to influence climate and health decision-making plans, and also it influences funding and programs, and when it comes to determining investment plans within a country. For health to appear in national adaptation plans, in national communications, in NDCs, which are the top ranking commitment programs when it comes to the climate change, UN Climate Change Framework Convention. And this should also appear within financial programming. Well, for instance, we need so much money to build health systems understood as something that goes beyond the mere action of the Ministry of Health. These are health promoting actions. The Ministry of Health needs to be involved at different levels in these processes in order to build, maximize, and prioritize policies that encourage health. Here in the green button, we see some of the actions. Also, major investments in climate resilient health and services infrastructure. We need to prepare hospitals. We need to prepare physicians, nurses to face climate change effects. They should be informed and they should be able to anticipate these issues so they can act when something related to climate happens, because it may harm people's health. Also, building integrated climate monitoring systems and health monitoring systems. We need these systems in order to create early warning systems to anticipate problems before they happen. And they should also be integrated health data platforms that have information from meteorological systems, health systems, environmental information, social demographic information in order to create risk maps and to model all this information for the future. And with this, we would have feedback regarding for the planning and financial side of things. This is essential within ministries of health at different levels. And this should be done in a coherent manner within nationwide policies. Of course, we also have research and education in climate and health for health professionals, but also for the whole of society. They need to be, everyone needs to know about this and be ready. Regarding governance, and this is just an example, this is the Caribbean Action Plan on Health and Climate Change. This was one of the largest meetings in the Caribbean that brought together ministries of health and the environment. This was an amazing achievement considering the impact of climate change on health in the Caribbean. And it was just a sign of the political efforts made. So within governance, we can talk about government and the importance of all this, because this is what opens the door and, allows us to work from a political perspective and technical perspective on the priorities as identified by countries. So then we can find an easier way to make technical progress if we have already defined these agreements and political liaisons at a higher level. So we have this action plan as an example.
Is to work on, and this is from the latest COP in Glasgow, where so far 59 countries have sent their commitment letters on for the first time in any COP, a health argument for climate action developed by the community and in being incorporated to a health and climate change official program. So little by little, health issues are being integrated. And this is part of building governance structure across countries at very high decision-making level. And if you want to look at this report on COP26, the health argument for climate action is available. But it's not just about governments discussing it or discussing this in meetings, but rather we need to have governance practices in place where we can reach out to civil society, for example. So in addition to the healthy climate prescription letter that was signed by several health organizations around the world, this really shows a commitment. This really shows that there are people who are interested in pushing forward and in establishing working groups on health and climate change across the Americas. It is led by CGHA, Landsat Countdown, and as my friend Stella will tell you about it in a few minutes. And there are so many other initiatives. For example, the Climate and Health Latin American and Caribbean Network. And this is just some information for you to, it's a teaser for you to discuss some of the ideas and to really know about the things that we want to follow up upon after the course. We want to promote the exchange of ideas and information. And also, we need to see how technical information can inform decision making. In these different processes, to incorporate different opportunities for consultation with civil society at high-level decision making, multi-country COPs, or even internally within the countries as we have been trying to do. Well, let me provide you with some tools, some resources, some documents that you can use in your day-to-day lives to build a climate change agenda and to adapt it to your national, subnational, municipal, or local needs. Well, I spoke about the Caribbean Action Plan. The Andean Health and Climate Change Plan is a great report put together by the Andean Health Committee for Climate Risk Reduction. It is great. It is a great report showing different commitments and expected actions at the regional, local level, success indicators for implementation. And now we are working on de developing funding plans for this report. the declarations of the ministers of health who are actually here with us today, many of you, and it is an honor for me to be here to share this session with you. So there are many tools, there are many governance instruments developed not only at the high level, but these are also action plans. They are not just merely political declarations, but rather actions that our countries are considered a priority for experts to implement. For example, PAHO. PAHO is a technical cooperation agency, and we are now developing a plan in Central America as well. There are several materials. I will name a few produced by PAHO, WHO. They are free of charge. I want to encourage you to look at it. For example, one of them is how to conduct vulnerability and adaptation studies on health issues. There are several materials on how to develop a national adaptation plans regarding health issues and how to increase and enhance NDCs after countries were encouraged to review the national determined contributions, and these are the commitments of the different countries with the UN Climate Change Convention, not just with regards to climate change, but adaptation as well. So these are some of the guides that you can use to develop your own plans and to engage your country, your municipality, and to really look at climate change from a health perspective. Danielle, you have 5 minutes. Good. So looking at the different country profiles, and we have basic and background information about the different countries. We are now, well, we started with the Caribbean. We developed climate projections for the different countries, strengths and weaknesses of the systems, regardless or independently from climate change. But what are the policies, the actions, and the investment in terms of health and climate change at the national level? We have another poll on Zoom. Haley, could you display what is the most pressing research gap in your country considering climate change and health? And I mean, I know there are many other options, but some of these are some of the options. I know, Haley, that we don't have much time, so let's try to do it quickly. I know we only have a few minutes left. Again, there's no one single answer, but I think it's interesting that most of you said to develop comprehensive or observatories for climate and health. Very few of you, for example, chose vector-borne diseases, which sometimes are very climate sensitive, or one of the most popular, so to speak, impacts on our countries. And this is the rationale of climate and health observatories. They are used as comprehensive platforms. Cristobal, Marcelos, Rachel also spoke about it. This is an example from Cuba. For example, the long-term infectious or respiratory diseases, vector-borne diseases, and so many other examples. We heard from Argentina, the early warning systems for heat waves. Cuba has made a lot of progress in this sense. Colombia, I'm not sure if Diego Lina is with us today, but many other colleagues from Colombia, where they developed the climate and health newsletter that I encourage all of you to look at. And Bajo, CIMH in the Caribbean, they have produced this climate and health bulletin for the past 5 years. And the idea behind it is to do 2-month projections for the longer term, the shorter term. And these are very, very nice initiatives that help us promote further learning on the effects of climate change on health to be better prepared. And maybe we can establish a local observatory. So many of you have been with us in these sessions, and it would be great to compile information across the Americas about what's being regularly reported and health surveillance. Infrastructure and resilient health services. Health accounts for 4 to 10% of national GHG emissions. Many of them are the result of the production chain, but around 30% is hospitals, waste management, and 77% of health centers in Latin America and the Caribbean are located in climate sensitive areas. So we need to also increase security around these healthcare centers so they can remain operational after extreme climate events. We're working very well with our partner in the region. We have produced several guidelines, different materials that not only addresses infrastructure, but health, personnel, staff. We provide different checklists for you to evaluate, but also not only to look at hospitals, but rather the entire health system. There is a commitment of the UN Framework Convention on Climate Change, and we hope that more and more Latin American countries sign these letters committing to a carbon neutral health systems to try to offset all of these conditions and to reduce GHG emissions and really anchor emissions in forests or other systems alike. And finally, to wrap up my presentation, you have 2 minutes, Daniel. Policies and intersectoral actions to prevent disease and promote health, and the tools for decision making at the local level. Something that I have mentioned already regarding urban spaces and health. This is good for decision making in urban areas, green urban areas. If I want to create a green area or eliminate a green area in my city, what would be the effects on health? Not only the effects on the health of our population, but also the financial impact or prescription programs of the use of different green spaces. For example, the impacts on mental health, physical health, and so on. How do we promote active transportation systems? And how do we measure the impacts that they have on healthcare? This can have an impact on decision making and the adoption of policies to promote health in Colombia. Based on the projections, they have analyzed how many deaths could be avoided and hospitalizations that could be avoided thanks to an enhancement in air quality. So this shows how one policy or another can have different impact in decision making. This is a good guideline for healthcare professionals. And also, these courses, for example, water safety plans, and are very important and are available on Bajo. Fellowship training programs are available in the Caribbean with a project that is carried out together with the United Nations, with the European Union. And also, this will be available under the IAI structure. Bajo is a delivery partner for a Green Climate Fund projects. So in the preparation for projects, we also have specific training opportunities and materials, and Bajo, Global Consortium, and other partners are offering initiatives and workshops of this nature as well. This is my last poll. Again, there is no single correct answer, but I want to hear from you. And this is also good input for our group to know what we should do. What is the most pressing research gap in your country with regards to climate change and health? I don't know if research gaps is the right expression, maybe implementation gaps or the need for more systematic work. Is it in governance and institutional structure, or where do you think that your country needs to invest further to advance a climate change and adaptation agenda? Governance, surveillance systems. This is very important information for us, as these topics cover the different sessions that we have produced. Thank you, Gilma. Thank you, Estela. It was really my honor to be here with all of you. I hope this is the first of many, and then we can continue in this path and journey together. Thank you very much. Thank you, Daniel, for your presentation. We will now hand the floor over to Stella for her presentation. Hi, Gilma, can you see it? Thank you so much for inviting me to be part of this course. I know that we have shared different sessions. I have very little time. I will do it very quickly. Our learning objective is the same one as Danielle's, to explore different tools for follow-up on climate change and the impact of health in Latin America. I will speak about the Landsat Countdown experience. This is a report that is published every year on the Lancet journal. We've done so since 2015. And this was the first report concluding that anthropogenic climate change threatens with undermining the last 50 years of any advances in healthcare. We also speak about the need to face and counter climate change and how we can turn that threat into an opportunity to enhance health around the world. The Lancet Countdown uses 44 indicators across 5 thematic areas. The first one is impact, the second one, adaptation and vulnerability, the third, mitigation and co-benefits on health. Daniel did mention this is something that we need to pay close attention to when devising mitigation strategies, and the impacts to health are already there. We need to quantify them.
The fourth component is a number of indicators as followed by the Lancet Countdown, and they have to do with the economy. Finally, there is the impact of public policies and the public's commitment to face climate change. So we follow these all these indicators. We have, this year we will be launching the 2022 edition. This is not so easy to do. We have 43 partners working around the world making this annual report possible. We work with PAHO, and they are a great partner to Countdown. We have over 120 experts working on this report. Have a look at the logos on this slide. The only one, this one, this is the only one from the South American region. And this is how Lancet Countdown South America was created. Historically, South America has been underrepresented in global reports. We do not have enough data on climate change and its impact on health. And we don't do a lot of research in this regard. This has created several information gaps and data that limit our capacity to act and take informed decisions when it comes to adaptation and mitigation in our region. I say South America because this is where we have our mandate. But now there's a new one being created in small island states with this same purpose, to try and help people and create and produce information in underrepresented regions. And these regions are the ones to be most affected by climate change. And they will be affected by lack of governance, as Daniel was saying. So what we do here at the regional center is coordinate the cooperation of several academic institutions. We try to contribute to global indicators. And most of all, we contribute to regional indicators that as of 2020, we have been following. How do we do this? We coordinate our work with other partners, we do research, and we extend our commitment. The idea is to achieve a regional and national political commitment based on evidence. So the Lancet aims to become a center where, with evidence, we can provide the necessary information for our decision makers to effect the evidence-based changes we need. That's what's most important for us. What have we been doing so far? We have been trying to expand our communications. So when the global Lancet Countdown is published, there is a launch event around October and November of every year. What we're trying to do now, and what we have been doing, is create policy summaries per country. So this is the first area where the scientific information we are creating from the global report can be then applied by countries, and country researchers are the ones that identify the key systems they want to address with the local or national governments. This is the first Zoom poll. The question is, Do you know a public policy in your country that addresses the issue of climate health, climate change and health? One, climate resilient hospitals. Two, sustainable transport. Three, sustainable and healthy urban green spaces. Four, decarbonization and electricity with low carbon emissions. Next, go benefits of sustainable diets, evaluation, risk evaluation in cities. And the last option, I don't know of any public policies in the area of climate change and health. The most important thing is for us to know if you actually know or are aware of any such policies that are being implemented.
Esperamos, ahí está. Espacios verdes, urbanos, interesantes.
There we go, green urban spaces. Some people don't know any public policy. People don't know what's happening. And sustainable transport, that's quite a low percentage. That's interesting, and we should continue focusing on it.
Lo que les comentaba de resúmenes de políticas y por qué hacer.
I was talking about policy summaries or policy briefs, why they're important. We use policy briefs in order to issue recommendations to a non-expert audience. They allow us to provide advice on science-based policies. As I was saying, we aim to help decision makers to make informed decisions. We provide the results of our research in easy to understand language. And this information can be taken in order to create, to have the evidence to design the policies. It seems easy, but I think it's one of the hardest things we've done, us who come from the academia, because we try to be so accurate and, you know, we're so careful with the information we find that many times we forget that we don't share the same language. This brought us to three key elements for our country policy briefs. Now I would like to tell you about the policy briefs we prepared for each country. 2021, we had 4 reports. Peru, 2021, we addressed 3 indicators. We took the information from the Landsat, and we considered that these factors were important. The impact of temperature, also glacier problems and adaptation. I would like to focus on the last topic, these adaptation measures to create health systems that are more climate resilient. There is a further advantage when it comes to, using these global indicators. Peru is a country that has a national meteorological system that provides services to the health system. However, and we need to consider the context of each country, in order to promote vulnerability reduction, the meteorological system must diversify and articulate national services within the country. It needs to cover more territory. It needs to provide climate forecasts, weather forecasts, etc. It's not enough to have an indicator, just one indicator, and that's that. What we need to do now, we need to harness this information, and we need to decide how we express it so that it works, so that it can provide us the information we need in order to actually implement these adaptation measures efficiently. Stella, could you please speak a bit more slowly to help the interpreter? Thank you. The other component was comprehensive adaptation plans, which are essential to ensure a resilient health system. We have been addressing this, and Daniel talked about it as well. However, Peru is at a disadvantage because we have low government expenditure on health. Also, households don't spend a lot of money on medicine or health exams. insufficient human resources. There is a huge gap in our areas, especially between rural and urban areas. And this has been made clear throughout the pandemic. So we don't all have the same access to health. When we talk about health, or at least in the regional Landsat countdown, we need to consider that we need a health system that has water, sanitation, electricity in every region. It needs health professionals that know about climate change, which is not the case nowadays. So we need to get these global indicators to reflect the needs of our region as well. Key takeaways for Chile. The policy brief for Chile addresses the importance of promoting healthy living through sustainable urban green spaces that are accessible to everyone. It also describes the need to strengthen decarbonization and the transition to zero carbon emission energy system. Finally, build fair food systems and sustainable food systems for health environments. I would like to address two topics in particular in this regard. First, what they try to say in this report is that although Chile has increased its vegetation index as used by the Landsat to determine sustainable green urban areas, although there has been an increase, in Chile, there is an extremely low index when it comes to other topics. So what they say as well, that this is a huge challenge for urban planning, for building houses and for green areas, because it says that although urban green spaces will have a huge impact when it comes to reducing temperatures in cities and improving people's well-being, that does not necessarily come from the health sector. To do this, we need articulation between the ministries. So when we talk about our NAPs, our national adaptation plans, and we say that health should be the focus of our efforts in order to, have funds, that's right, okay. But we should remember that the other ministries also should make their contributions so that health can improve, so that we can actually perceive these health co-benefits. Another interesting topic which I find very interesting, because the policy briefs have negative items, but it's also worth mentioning that there are some positive things to highlight as well. Chile states that they are undergoing an decarbonization process, and they have increased the use of wind and solar electricity. Why has the country done this? Because they acknowledged the urgent need to reduce human exposure to air pollution. In the 2020 report of the 15 of the 20 cities with the highest air pollution rates were in Chile. So it's interesting to see how this happens, and we need to see what happens in the field of research. We need to see if there is actually a change in policies, if it's not just words, or people are mad about things or whatever. There should be changes, and these positive policies should be implemented. And this is another interesting example. Chile is the 4th country in the world with the highest use of electricity per capita for road transport purposes. So once again, Chile is, setting an example. And also in the region, the country shows us that we shouldn't reinvent the wheel. We shouldn't focus on other countries. We should look at what countries in the region are doing and follow their example if what they're doing works. This is a global Landsat countdown indicator. It says that the electricity used for road transport has indeed increased around 15% between 2017 and 2018. But that is, so small within the energy used for road transport. And this sector's emissions keep increasing, unfortunately. However, some countries are actually implementing these changes in order to improve air quality in their cities. Stella, you have 5 minutes. Regarding the key takeaways and recommendations for Brazil. One, promoting and implementing healthy diets everywhere and at schools. Also, improving local food chains and reducing exposure to air pollution caused by fires. This is also a Landsat countdown indicator, which shows us which are the co-benefits of having a healthy diet. As we know in the region, Argentina and Brazil are the two countries that with the highest consumption rates of red meat in the region. In Brazil, it is estimated that 40,000 premature deaths take place because of eating red meat, because there is an increase in chronic disease, cardiovascular disease, etc. And the same applies to Argentina, 20,000 deaths. But in Brazil, they are responsible for the largest agricultural expansion. And actually, they are affecting the largest carbon sink in the region, the Amazon. So we can see that everything is closely interconnected and how mitigation strategies for the region. And of course, they are related. Our priority should be preserving the Amazon, of course, but also it will impact the co-benefits of healthy diets that will impact populations as well. Haley, there we go. The second question. Why is it important to conduct risk assessments in cities? One, the vulnerability is different in each city. Two, you can develop adaptation responses. Three, each city has a degree of readiness that is different. Four, implementing these plans will allow us to take quicker action. And five, it's important for each city to allocate the necessary resources to face the impact of climate change. There are no right or wrong answers, of course. Let's give you 1 more minute because I have 3 slides left. I would like to complete the presentation. Thank you.
Bueno, nos vamos a nivel de ciudad diferente para cada uno.
Okay. Yes, of course. Each city then should actually assess the risks per city, and that's a key takeaway or the main recommendation for Costa Rica for the 2021 policy brief. Costa Rica is focused on gender vulnerable populations, on promoting local intervention mechanisms in order to evaluate the impact of temperatures. It also develops and implements action plans to reduce greenhouse gas emissions, but through a gender and inequality perspective. And number 3, transport. Let us look at the risk assessment in each city. This is also a Landsat countdown indicator. It evaluates the number of cities that have completed a vulnerability or risk assessment when it comes to climate change. It also impacts on health as related to climate change. In Costa Rica, they have found that only 14 urban centers in the country have, completed the survey. It's a voluntary survey, so it is not representative of the whole country, but of the city. that completes the survey. Still, it gives us an idea of what's happening. So 10 of the 14 urban centers have gone through the evaluation process, and 8 have identified that the most important thing for their cities has to do with vector-borne diseases. And something they mentioned as well is when there's a problem with sanitation services, water services, or other sanitation issues, especially when there are floods or droughts, and they have a serious issue in this regard. What is interesting is that they have started to talk about vulnerable populations, and they have now considered all this within the assessments. They actually proposed within this public policy plan that we should promote or encourage local governments to conduct these vulnerability assessments in order to understand risks at city level and also to be able to allocate the necessary resources to prevent these problems. So this was the final slide. I'm sorry I spoke so quickly at the beginning. Hopefully you'll be able to watch the recording. It's very difficult to address all these topics in 15 minutes. Thank you.
Un excelente trabajo, entiendo. Es mucha cosa por...
Thank you so much, Stella. It's great work. I know we have very little time, but we will have probably other opportunities to keep working together. So we do have several interesting questions asked by our participants. So the first question, Daniel, Ana Pinzón. From our work as researchers and citizens, how can we impact or influence public policies? And sometimes people think about that policies just, restricted to meetings, to checklists, and it's not really clear what the role of researchers and citizens would be when it comes to, validating these public policies. Thank you, Dilma, for the question. I think that throughout the course, we have provided several specific examples of how this can be done through early warning systems, also newsletters, etc. This is how health information can inform decision-making, policy-making, and also individual actions. This is one of the ways in which researchers can keep up with policies and, have a direct impact on reducing the effects of climate change on health. It's also great to be able to support the government at different levels when it comes to including this information in existing policies that will have an impact on decision making. For instance, I talked about I said that we should stop subsidizing contamination, and this has to do with a political decision. Up to, not long ago, tobacco was not regulated. We had people smoking in every film. It still happens, but it wasn't as regulated as now. And people didn't know about the harmful effects of smoking. There was a very famous health action, of course, the Global Framework Convention on Tobacco Consumption. Regulations have been issued, rules, specific legislation, with, of course, financial consequences in order to reduce people's access to tobacco products. So we should consider all this, and researchers should provide this information for decision making, because if we don't know what's happening, then it's very difficult to take the necessary action. And this is why publications such as the Lancet is so important. Thank you, Daniel. Stella, which mechanisms are in place so that a country, institution, or organization in any South American country can contribute or be part of what you are doing with the Lancet Countdown? Thank you for the question. You can do this in several ways. Within Lancet Countdown, we have an area where researchers can actually contribute to our efforts in different ways. First of all, they can just be part of the network. Second, they can contribute and support us, and we can also help support case studies for the region. As Daniel was saying, without evidence, we cannot make effective decisions. So, for instance, you can help us create study cases and connections among countries. We can also, bring together global researchers and local researchers within the region. We don't need to do, the whole research, the entire research together, but we can help you connect with other researchers that might want to work within your research area or in your country. That's one of the ways. And third, of course, communications. We hold annual launches, we launch the report, we try and get the word out. We try to inform people, we try to get people to know what we're doing through policy briefs or through the events we hold annually. So there are several mechanisms that actually do exist. Thank you. We do have a further question that both of you can answer. How are mitigation and adaptation funds managed? Because they're supposed to be managed by environmental agencies. Do you think that that management model actually favors investment in the health sector, or should that be changed somehow? Stella has something to say. That's a great question. I was going to say, Daniel, go first. You're more diplomatic, but no, I think it's a great question. In the case of Peru, and I think I'm going to be critical of my country. Yes, this is led by the Ministry of the Environment. So health has, a secondary position, and our health adaptation measures now, we used to have 14, but now we have 5. So everything gets reduced because of budgets, because maybe we can't see the full picture now. We don't know its importance, but we need to be able to communicate why health is at the core of everything that will happen. The rest needs to, enable health and, encourage health to be promoted, because it is us who's going to be affected. Of course, everything is important, but health is a main focus. And in my opinion, that is what is lacking nowadays. Sorry, Daniel, go ahead. Hopefully you're more diplomatic than I. No, I would be even less diplomatic.
Yo creo que voy a poner yo estoy de acuerdo, pero voy a poner un poco de la culpa.
I agree, but I'd like to, blame health a bit as well. When we, visit a new country, we talk to ministers of health, and we ask them what they need in order to have a climate health agenda. They say that they need funds and people. All of them say this. And our follow-up question was always, okay, let's imagine that we can give you now $50 million. What would you do today with that money? And as there is no information, it's an issue. The issue is not just having money and people. It goes beyond that. And this is why our agenda, starts with governance. And also information needs to be created, shared, discussed, reflected and reshared. And then you can tell us which actions we should take. In many climate change and health areas, we are aware of just the tip of the iceberg. And we need to get to know that iceberg so that we can actually do something. So it's important to understand what the problem entails, which are the actions to take, and also to measure the success of interventions. And this is why we have this section on co-benefits. If energy-related policies promote health, also transport actions, cities, etc. Regarding food systems. So it's essential to include health in every policy, and it's important for health to be part of the structures as well. And this is why I keep saying, well, okay, item 1, the most important thing is governance. If we don't have governance structures, if health is not empowered, if health people are not empowered and lack the necessary information to take informed decisions, there's no way to make progress. It's not all about money, and it's not all about having a lot of people if we do not have, a strategic vision, if we cannot talk to each other, and if we lack key information. So there's no easy answer to that question. It's actually a number of factors that need to be addressed simultaneously in order to actually take climate and health related actions. Thank you. Yes, I would add the importance of, human resources. I shouldn't just recruit people all the time. We need to have trained human resources. And I think that in this course, we have worked in this regard. And we actually need to have trained people, and it's important, to create evidence, to have indicators that allow us to see how we progress or how we are going backwards. Thank you to both of our speakers. I think the presentations were excellent, and thank you for your answers. I'm going to share my screen to tell you about some of the things for the future and for the participants of this course. So please allow me to share my screen. Just a second.
Bueno, primero que todo, pues quiero dar las
So
gracias.
first of all, I would like to thank you for all the people that have participated in this course. And thank you to those that were part of the organization, also the 3 institutions. I would like to thank also the working group that supported this process. And we had people from the 3 participating organizations. We also had the participation of the Ministry of Health of Uruguay. I would like to thank all of our speakers who did an amazing job. And we need to remember that how, as participants, you are going to apply everything that we have seen, and we need to keep working together as well. Thank you, everyone. We had 3,000 participants at different times of the course. We had between 700 and 900 people who attended the sessions live in a week. And then we had between 100 and 200 YouTube visits. Thanks to every country, to every discipline that participated in this process. I think that it has been a huge success. And as Stella was saying, it's the end of the course. And I was saying, no, it's actually the beginning, because this is something that starts today. And it's like, you know, an appetizer of what we'd like to share with you now. Some, you know, logistics, certificate and final exam. You will be getting an email after this session with instructions on how you should take the final exam. Once you get the email, the exam will be available 72 hours until the 22nd of May at midnight. And the certificate will be issued to the people attending 70% or more of the sessions and that pass the exam. These people will get the certificate. We would like to take maybe 3 minutes for you to reflect on the course. In the chat, you can see the link, or you can scan this QR code with your camera so that you can please provide us with feedback. It's very important to have evidence of what we do. And one way to do this is to see how we can improve our process. So please, Haley, can you please share this in the chat so that people can complete the end of course feedback survey? Thank you. You have 3 minutes to complete the survey. Thank you. Please, we're very interested in your feedback.
Seguramente después de que terminemos lo de la encuesta vamos a tomarnos probablemente unos 5 minutos más.
After the survey, we might take 5 extra minutes to talk about our future work. So please don't leave the meeting after you complete the survey. Thank you.
Bueno, nos queda 1 minuto para terminar de diligenciar la encuesta.
So 1 more minute for you to complete the survey.
Bueno, muy bien. Yo creo que ya.
Well, I think you've had now enough time to complete the survey. I would like to tell you that as a group, we'd like to invite you to be part of the climate and health community of practice that we would like to create. Basically, we think that this course has allowed us to, think of ourselves as a climate and health community of practice in Latin America. And the idea is to connect professionals from both areas in the different regions. And the idea, is to intersect education, policy, and action. This, I think, follows the guidelines in the survey. And it also has to do with Stella's invitation. It's very important to establish this connection, to have working groups that work with evidence and to monitor climate-related risks. In the next few days, we will send you this registration information. If you want to be part of this network, we'll be sending this to you by email. A follow-up event regarding this community of practice on climate and health would like to invite you to a course on transdisciplinary research on climate, the environment and health in the Americas. The EAE will be organizing the course, and it has the support of PAHO, and also it also has the support of other organizations. Topics: understanding the meaning of transdisciplinary research, how to manage databases, how to have scientific communication skills. They will be working with speakers from a conceptual perspective, and also examples will be provided through case studies. The format will be very similar to this course, but there is a minor variation, because 3 times during, we'll have 3, let's say, moments. The virtual course starts on the 20th of September, 7 weeks, twice a week, English and Spanish. Then, after that first course, we will have working teams that will develop a preliminary proposal of a research project that they would like to implement as a team. So we would have an in-person workshop, and stage 3, after analyzing the proposals received, a few of the teams would be selected according to established criteria, and they might, receive some seed funds in order to develop their proposals. In the coming days, we'll be sending you an email providing you with more details on this, on the enrollment process, and hopefully many of you will attend the course as well. We aim for this process to be gradual, and the idea is to improve science production in Latin America. Also, if you're from a government organization, non-government organization, students, individuals, please join the global consortium. And this is the link. If you would like to join the Global Consortium on Climate and Health Education, please register with us. We should remember that now we are 260 members of the consortium. We have representatives in South America, some in the Caribbean as well, but there's still too few of us. If we want to actually effect this change, and we need to in order to improve our conditions when facing climate change, I think we need to work together, and this is a great opportunity to do so. These organizations have also participated. When we work on climate change, it's impossible to do something just with one sector or one discipline. This is the joint work of several organizations, disciplines, individuals, and it's a lot of work. Transdisciplinary, disciplinary, and interdisciplinary work. So once again, thank you very much. Hopefully, we'll see you again. You're already part of the practice of the community of practice. You just need to register, and we'll be sending you the information by email. Thank you, everyone. Thank you to all our colleagues. Thank you for participating. And if you would like to, because many people wanted to interact directly with some of the speakers of the course, please send your email to Hailey, who is our project coordinator, so that we can then connect you with the people you'd like to contact. Thank you again. Have a great day. And hopefully we'll see you very soon in the transdisciplinary research course. Thank you very much. Bye-bye. And a round of applause for everyone. Thank you so much.